All right, welcome. Getting a testicular cancer diagnosis, it's a lot to take in. It can feel incredibly overwhelming. So today, what we're going to do is cut right through all that complexity. We're going to give you a really clear step-by-step guide to the entire surgical journey, right from that initial diagnosis all the way through to recovery. So, a mass is found. What happens now? For the patient, this moment is it's filled with so much uncertainty, right? But on the medical side of things, it kicks off a really fast and incredibly precise evaluation process. Time is of the essence. And it's so important to understand this isn't just one single event. It's really a carefully planned journey. The path from that first diagnosis to hopefully a cure involves a whole series of critical steps. And that's what we're here to do. We're going to walk through every single one of them together. All right, first things first. From mass to diagnosis. The absolute top priority is figuring out exactly what this mass is. And this has to happen fast, because testicular cancer can move pretty quickly. So to get a really clear picture of what's going on, doctors use this kind of three-pronged attack. It all starts with a detailed history and a physical exam. Then they bring in the tech, a scrotal ultrasound. Think of it like a super high-def camera that lets them see the mass up close. And finally, they do blood tests to look for these specific proteins called serum tumor markers, or STMs. These can be telltale signs of cancer. Okay, so if cancer is the likely culprit, the very first, most critical surgical step is what's called an orchiectomy. Basically, that's the removal of the affected testicle. And it's interesting because this procedure isn't just a treatment, it's also how they get the definitive diagnosis. The standard procedure here is called a radical orchiectomy. And what's really fascinating about this, and super important, is the approach. They don't make the incision on the scrotum. Instead, they go in through the groin, what's called an inguinal incision. Why do they do that? Well, it allows the surgeon to get control of the spermatic cord really early on and clamp it off. That is an absolutely critical move to make sure no cancer cells can break free and spread during the removal. But here's the thing, it's not always a one-size-fits-all kind of deal. It's actually a pretty delicate balance. While that radical orchiectomy we just talked about is the gold standard, in some really specific, rare cases, like with very small tumors, or if the other testicle isn't healthy, a partial orchiectomy might be on the table. The goal is always to get rid of the cancer, but also to preserve as much long-term function as they possibly can. All right, so after the orchiectomy, the big question on everyone's mind is, has the cancer spread anywhere else? And answering that question often leads to another major surgery for many patients, called an RPLND. And you might be thinking, wait a minute, if the tumor is out, why on earth would you need another big surgery? And that's a totally fair question. The reason is all about how this particular cancer travels. It has this really predictable roadmap, and its first stop is almost always the lymph nodes way in the back of the abdomen, in an area called the retroperitoneum. So this brings us to the retroperitoneal lymph node dissection, or RPLND. It's a complex operation for sure. The best way to think about it is like this. Imagine the body's lymphatic system is a highway network. Well, cancer cells can use these highways to travel. And RPLND is like going in and clearing out all the key interchanges and on-ramps in that part of the body to stop the cancer in its tracks. Now, this chart, this is incredibly revealing. This shows us what doctors often find in those lymph nodes after chemotherapy. You see, even if a CT scan looks pretty good, surgery tells the real story. In about 40% of cases, it's just dead tissue, which is great. But look at this. 45% of the time, it's a benign tumor called a teratoma. Now, benign sounds good, but this thing can keep growing and cause problems. And then in a crucial 15% of cases, it's still active, viable cancer. This right here is exactly why this surgery is so vital. It's literally the only way to know for sure what's in there and to get it all out. Okay, so now we get into the really nuanced part of the journey, navigating the treatment decisions. This is where things get complex, and doctors and patients really have to work together, weighing all the risks and benefits. It's where the science of medicine really becomes an art. And this leads us to one of the biggest debates in treatment. Let's say the chemo works like a charm, and the tumors shrink down to almost nothing. What do you do? On one hand, you could just observe, watch things closely. The survival rates for that are around 90%, and you avoid a huge surgery. But on the other hand, we know that even tiny leftover spots can hide teratoma or even active cancer. So some argue for doing the surgery to be absolutely sure. There's no easy answer here, and both approaches have great results. It really becomes a deeply personal decision.
And it's not just whether to do the surgery, but how to do it. The procedure itself has evolved so much. You used to have just one option, the full bilateral template. That means removing all the at-risk lymph nodes, which is very effective but can have more side effects. But now there's the modified template. This is a much more targeted approach, where surgeons only remove the lymph nodes in the primary landing zone for the cancer. This incredible refinement often gives you the exact same high cure rate, but with way fewer side effects, and that means a much better quality of life down the road.
So after all these complex surgeries, all these tough decisions, what happens? What's life like after? Well, the news here is it's overwhelmingly positive. Just look at that number, over 90%. In the world of cancer care, that is a truly remarkable figure. But what does it actually represent? Well, it's not just about survival. It's about something just as important, quality of life. What that number means is that with modern, nerve-sparing surgical techniques, over 90% of men are able to preserve normal ejaculatory function. I mean, think about that. That is a massive leap forward. It has a profound, life-changing impact on things like fertility and just overall quality of life for decades to come. It's a huge win. And when we look at long-term survival, the story is just as impressive. It really depends on what the pathology finds. So if the surgery only turns up dead tissue or that benign teratoma we talked about, the cancer-specific survival rate is fantastic. We're talking 85 to 95% or even higher. Now, if they do find viable cancer, the odds are tougher, yeah, but even then, this surgery still gives patients the absolute best shot at a cure. You know, when you boil it all down, this is really the main takeaway. The whole story of testicular cancer surgery has changed. It's not just about getting to a cure anymore. The cure rates are already incredibly high. The focus now is on preserving long-term quality of life, making sure that patients don't just survive, but that they truly thrive for decades after their treatment is done. So that brings us to the final, really big question. With cure rates already approaching 100%, what's next? How is medicine going to make this journey even easier for the patients of the future? Well, the next frontier, it seems, is all about reducing the burden of the therapy itself, making it less invasive, even more precise, and shifting the focus even more onto the person and not just the disease they're fighting.